and most important one is to please make sure to keep your cameras and your microphones off at all times. Check now to make sure that they're off. Please don't touch your settings. Please keep them off the whole time. And next, if you have questions for Laura during the course of the presentation, you can just pop them in the chat box and we will get to them as many as possible at the end of today's presentation. And now I'd like to introduce today's speaker. Laura Cohen is a former registered dietitian whose personal and professional life did a full pivot with the diagnosis of her then 16-year-old daughter with anorexia nervosa. One of the hidden gifts of this excruciating journey was Laura's transformative shift to becoming an anti-diet professional and advocate for dismantling diet culture. Laura currently serves as a family mentor with Equip and facilitates their free-form group for parents, which is a body empowerment program that teaches participants to challenge diet culture and social body ideas. Laura is also a valued Feast parent support volunteer. One of the things that I admire about Laura is that she always shows up for others, and that I can always depend on her to give me great insight and solid advice. I feel privileged, both on a personal and on a professional level, that Laura is such an integral part of our Feast community, and I'm so happy to have her here with us today. Laura, you can get started now.
Wow, I think I'm speechless. All right, let me share my screen real quick so I can get us started. Okay, I'm assuming everybody can see that. Thank you for that hold on, I'm just turning a couple of other things I had to do. Thank you so much, Judy, for that warm welcome. I'm so honored and thrilled to be here with you all today. Another reminder to turn off your screens, turn off your not your cameras, your sounds, because there's always, I know I've done it, we leave it on, we go, oh no. So today's topic is fat phobia and how it can affect your loved one's recovery. Before I get started with my talk, I always like to start with a little story. So a couple months ago, I was in Arizona with my husband. I was actually at a work retreat, but we came out a couple of days early and we were in Scottsdale, Arizona. I know this is a global call, so could be people from all over the world, but in Arizona, wanted to do a hike. I'd been there before, so wanted to hike Camelback, which is a mountain that's there. So I went into a Google app to pick a trailhead and got ready, got in the Uber, knew where we were going, till the Uber driver who said to us, oh, I'm going to take you to a different trailhead. It's so much better. So of course I grilled him with a million questions and he was like, you're good, you'll be fine. Now, mind you, he was half my age. And I kept saying to him, I haven't hiked in a long time. And he just reassured us we'd be okay. So just so you know, this was about 1/8 of the way up the hike, and it continued this way the entire time. What he didn't do, which I'm going to start my talk with, is he never gave a disclaimer. I would have loved to have seen this sign at the very beginning of the hike to know what we were getting into, but I didn't see this till the end. I don't want to give you all a disclaimer at the very end of my talk because that would be silly. So my disclaimer today that I'm going to, this is the only thing I will read because I want to make sure I don't forget anything, is, as Judy said, I'm a parent volunteer for Feast. I'm not a doctor. I'm not a psychologist. I'm not a psychiatrist. And my presentation is based on a combination of my lived experience as a parent with a child in recovery from an eating disorder, and as a parent, mentor, coach, advocate, all the above, whatever you want to call it, to other parents whose loved ones are going through eating disorder treatment. I also want to call out my privilege. I stand here with a tremendous amount of privilege as a white, cisgender, heterosexual woman who holds financial stability. We all come to this work holding our own internal bias, and I work daily to overcome my bias. Also, while I'm going through my presentation, if I say anything that triggers anyone, if any of it feels uncomfortable, it is your choice whether you want to continue watching or just turn it off for a couple minutes, whatever feels safe for you. Some of my images, as I go through it, I chose a lot of stock photos on purpose, and they were done intentionally, almost to prove the point. A little bit of fat phobia is everywhere. So I will get started with that. My objectives today is for everyone to obtain a high level overview of what fat phobia, also known as weight bias, means and where it shows up. I'd love you all to learn how to start to identify fat phobia, to start to dismantle your own deep-rooted beliefs. Again, if you choose, I will provide the information. You all make your own choices what you'd like to do with that information. And I invite you to remain curious, and most importantly, be patient with yourself. I do have a little thing with my throat, which makes it hard to talk a lot for long periods. So I will be taking lots of sips of water. So just wanted to call that out as well. Okay, here we go. Right on the screen. I like to go right at it. Fat. When you hear that word or see that word, what does it invoke in you? Does it make you feel uncomfortable? Does it make you feel proud? And any answer is fine. Some different possible thoughts that people have about fat people. Fat people are not healthy. Fat people are lazy. I never want to be fat. Parents should not allow their kids to be fat. Fat people must have no willpower. Fat people should lose weight for their health. Fat people cannot have an eating disorder. Fat people are not fit. The other thing I want to point out when I'm using the word fat is sometimes just using the word makes people uncomfortable. People who are fat activists in the fat community are really working on making it, fat is just a descriptor. It is not a bad word. Just like calling someone thin, there's no difference. Here we go. What is fat phobia? Again, a stock photo, which is just such a ridiculous photo, but it kind of made me giggle a little bit. What is fat phobia? Fat phobia, as the name implies, is the fear of being fat or fatness around you. Another name for this phenomenon is weight bias. Quite simply, it is judging the personality of someone or their intrinsic characteristics based solely on their body weight and outward appearance. But what does fat phobia have to do with eating disorder recovery? Since that's what we're here for today. But I want to take a step back, not really just to talk about myself because no one really needs to hear that much about me. But I also feel that I want to give you a little bit of an introduction. I know Judy talked a little bit about my story, but some reasons why I'm sitting here right now. I grew up in Miami, Florida. So my father was a dermatologist. So everything was and that's why we moved down there. That's why I shared that. So everything was my whole life, seeing a lot of skin, wearing bikinis, going to the beach year round, just very appearance focused. When I was an older teen, around the age of 15, I became interested in nutrition. I actually saw a registered dietitian because I wanted to lose a couple pounds, which thinking back on this, it was kind of ridiculous because I never lived in a larger body, but hey, I was 15 and just like a lot of 15-year-old girls, I wanted to lose a couple pounds. So I saw a dietitian and I was very intrigued by the work that she did. I thought it was really cool to sit and talk to people all day about nutrition and their diet and all the things. She had all the plastic food. I thought it was really cool at that age. So I decided that I wanted to go to school to become a dietitian, which is exactly what I did. I went to Syracuse University, straight from Miami, Florida. So if anyone knows, Syracuse is right in the snow belt of upstate New York. So I finally saw snow at the age of 18 and, did my undergraduate degree in nutrition. I sat for my registered dietitian exam and I went right to New York University and I got a master's also in food and nutrition. I was very intrigued by food and I really wanted to teach people how to cook more healthfully. I also got my associate's degree at Johnson and Wales University in culinary arts. So as you can see from my professional background, I was all things nutrition and health and wellness. And, I was really gonna take on the obesity epidemic, because back in the 80s and 90s, that's all my education was based on. But my most important job really became a mom. I did some work in the field. I worked at Mass General Hospital as a dietitian, as well as had my own personal chef business. But when I became pregnant, I wanted to be home with my girls. So that was mainly what I did. I mean, I had jobs, but it was really to stay home. So the first photo was, you can see my older daughter poking at my pregnant belly with my younger daughter in there. And then on the right is my two girls when they were little. They're 21 and 19 now, just to put that in perspective, how old these photos are. But that's my little baby, my blondie, Alexa in the front, and Danielle in the back. What I didn't know when these pictures were taken, and I jumped into the wellness fields through all of their upbringing in their childhood, teaching people how to live in their healthiest bodies. I say that I was a wellness entrepreneur. I did all things health and wellness. What I didn't know was that my little girl here on the left, who's the lights up every room, and that really is and was her personality. And then you can see in the other two photos, she was a competitive gymnast until she graduated high school, from starting at the age of 6. She was going to develop anorexia nervosa at the age of, diagnosed at the age of 16 and a half. Right in the spring of 2020, when the world shut down, I knew something was going on with my baby. She'll always be my baby. What I didn't know was that she was struggling with an eating disorder. Completely rocked my world, as a lot of you all listening here, it rocked your world too. And I also do like to share with fellow parents that even though I was a professional, I was a dietitian for all those years, and I worked in the industry, I didn't know that that's what my daughter was struggling with. So I always want to give people grace. When you missed all the signs, professionals, we miss all the signs too. But what really happened with that was, during this period of my daughter being diagnosed with anorexia, it made me take my own look in the mirror, and all the things that I learned about health, nutrition, wellness were being rocked. And I didn't want to acknowledge them for a while, because I thought I was doing all the things right, everything that I was taught. I learned really quickly that when we know better, we do better. And you'll hear later on, that's what I did. But fast forward to 3 years, we're actually almost at 3 years of my daughter's diagnosis. And I'm proud to say that she's doing great. She's a freshman at University of New Hampshire. These were her pictures, her first week of school. Don't want to leave my older daughter out of the talk, because she's part of our journey and our family as well as my husband, who is not pictured. But the journey takes the whole family. So she's doing great, and just wanted to highlight that. But as she was going through her own recovery journey, I was doing my own recovery and my own soul searching. And you'll hear me talk later in this webinar about how I learned how before and afters are so toxic, but I need to share my after with you all. So what was I going to do with this? So the first thing I did was, I wanted to become an advocate. I wanted to help other parents. I reached out to Feast. I waited till my daughter was in a more solid footing, and I became a Feast volunteer, which is why I'm sitting here right now, because I became very active and still continue to be active in Feast. During this whole process, I re-educated myself. I became certified as a professional intuitive eating practitioner. During this time after that, I really wanted to get more involved in the eating disorder community. An intuitive eating practitioner was fantastic, but that was such a small piece of the puzzle. So through the Carolyn Costin Institute, I became certified as an eating disorder recovery coach. And then it led me to what I do now. And I'm super proud that I work with Equip, which is a fully virtual eating disorder program. And part of their, what we like to call our secret sauce of recovery, is I am a parent, not a volunteer, I am a family mentor. So I help parents through the eating while their loved ones are going through the treatment, going through eating disorder treatment. I am an advocate to them. I work one-on-one with parents. Okay, so let's go back to the topic at hand. What does fat phobia have to do with eating disorder recovery? Whenever I do talks, I really like to keep them somewhat organized, or I go all over the place. So the way that I broke down this talk was 10 ways that fat phobia can affect eating disorder recovery. When I chose 10 because it's a nice even number, but by no means are they in order of importance. There's a couple that I threw in there on purpose at certain places in the talk, but by no means is number 3 the third most important one. Number one was put here intentionally because, you know, most of the people listening to this talk were caregivers, we're parents, caregivers, have some practitioners in there. And we all come to this with our own internal fat phobia. There is no way to live in the society that we live in without our own internal fat phobia. No matter what size your body is that you reside in, we still carry that internal fat phobia. And as your loved ones are going through treatment, it's one of the most important things that you can do for your child's or whoever that loved one may be for their recovery is to really look inside of yourself and see where you carry that internal fat phobia. I love this quote by Una Hansen, and I tell people to follow her on Instagram. She's awesome. She is one of my peers at Equip. She's a family mentor with Equip, but she's also an educator and a parent coach. And when we talked about this topic, she gave a great quote. What happens when we fear exactly what the eating disorder fears? So our loved ones are terrified often, not at every eating disorder diagnosis, but one big factor is they're terrified of being fat. What if we as caregivers, we're scared of that too? We're scared to have our child reside in a bigger body than they ever did, because often in recovery, you know, our loved ones are going to recover in a larger body. What happens when we fear that, when we're uncomfortable with that? This is all a process to really learn about our own feelings, our own beliefs. I encourage people to become curious about your thoughts and your beliefs. When those little thoughts come in your head, listen to them. Think about them. Recognize how you feel about your own body. Again, I know that I had my own issues with my body. We all do. This is natural. We are in a society that's what we live in. Also being aware of your health beliefs. We'll get into this further, but our health beliefs play a huge part in this as well. Be open to challenging. Really learn about anti-diet, which I will say, I thought I was an anti-diet practitioner. I was far from an anti-diet practitioner. I said that I didn't like to talk about diets, meaning very structured diets, but everything I stood for was not anti-diet. It was all about getting people as healthy as possible. I also encourage people to look into HAES philosophy. HAES stands for healthy at every size. It was not something I was familiar with when I worked in the field. Actually, the first time I learned about HAES philosophy, and Judy can put this in the chat, was through Feast and a Dr. Rebecca Peebles, that a lot of you may know her. She's a eating disorder physician at CHOP in Philadelphia. She did, in Feast of Knowledge, she did a talk in 2020 about HAES. And I vividly remember I was walking my dog listening to this webinar, and I was like, wow, it all made so much sense to me. So I encourage you all to learn to lean into and to learn more about HAES philosophy. The impact of family and friends. I can say firsthand with my lived experience that going through recovery with my child is really lonely. And I encourage people to lean into your family and friends. With that being said, they often say things that they don't realize that can be harmful, that can impact us. These were actual quotes that through the process, I also am an admin to a couple really large eating disorder parent, loved ones forums that support loved ones through, that support caregivers with their loved ones going through eating disorder treatment. And I asked people, how did fat phobia show up in your child's recovery? And one woman gave a long story, and I take a quote from it, and she said, meaning her daughter, when she was eating 4,000 calories a day, which is not unusual, the constant question from family was, is she going to be, and I don't like to use the word obese, I use it because that was part of this quote, is she going to be obese? When will you stop feeding her so much? And these are the comments we get. This is actually a comment that was personal to me. As I said before, I was a dietitian. One of my dear friends at the time was a dietitian and a colleague of mine. And this was the first summer that I was refeeding my daughter. And I had a call with her. We were just touching base, and I was explaining to her all about refeeding. And I was actually excited from colleague to colleague to explain to her about eating disorder recovery, because neither of us learned it when we were dietitians. It's not something that we learned about, at least back in the 80s and 90s. Recovery was very different. I had never heard of FBT, family-based treatment, and I was educating her. And obviously it was very personal because I was educating her with my own lived experience that I was going through right now. And I was sharing with her how I was buying all the heavy whipping cream and the butter and all the processed foods, and this is how you refeed someone with an eating disorder and all the things. And I'll never forget, she said to me, Laura, you're going to replace one problem with another. And here I am, like, oh, SHIT, excuse my language. I can't believe she just said that to me. And it made me feel so insecure. It was even saying it, I still get emotional. This is a quote from a family that I worked with. They had an older teen who was about to go off to college, and she put herself into treatment because she knew that she had an unhealthy relationship with food. And as I told you all, I work with the parents. So as I was working with mom and dad, it was very apparent that mom and dad had a lot of internal fat phobia. And it was really getting in their way from their daughter wanting to recover from her own eating disorder. And dad, would say to me, well, she actually really needs to lose weight. If anything, she doesn't, she's put on too much weight. And then he said to me, I don't want my daughter to go to college fat. That's going to cause so many problems. So as I said to you all, to become curious, that's what I did with him. And I was like, well, what do you mean by that? And we had a lot of unpacking to do, but I have to say, by the time their daughter discharged, we did some beautiful work. We have a 5-person team, and we worked a lot with mom and dad, really unpacking a lot of fat phobia. And they learned a lot, and their daughter did beautifully. So I talk about standing up to well-intentioned friends and family. That doesn't mean we're exhausted. It's not our job to change them. It wasn't my job to change my colleague, my dear friend. I say she was a past dear friend for a reason. Sometimes you don't have the energy, and that's okay, but just know that they have the best intentions, but it may not be healthy for us while we're going through this. One of the most common questions that I get from caregivers, whether it's in my job or it's even on the forums where I admin, what do I say when my loved one asks me if they're fat? And I'm sure a lot of you are, if I could see all your faces, are shaking your heads going, oh gosh, they say it all day long, right? And this is a place in my talk where I'm going to put on a little bit of my coaching hat. I can't help it. I always feel I have to help people and provide that value. So what do you say when your loved one asks me if they are fat? Well, the knee-jerk reaction, which is exactly what I did. I still remember sitting in that chair with my daughter and her crying that, Mom, but I'm so fat, I'm so fat, I'm so fat. And what did I do? I looked at her and I said, of course you're not fat. You're not fat, and just kept reassuring her that she wasn't fat. And when I work with families and they ask me this question, and I say to them, what do you say? And they're like, well, I reassure her, of course she's not fat. and, you know, her bones are sticking out, you know, all the things, and, you know, or whatever body they reside in. Of course you're not fat. Well, the interesting thing is when you say that, you're actually reinforcing their fear by telling them, of course you're not fat. That's basically saying that fat is something bad, right? So again, we want to fix things. We want our kids to feel better, but that conversation right there is reinforcing what they're scared of, back to what Una said at the beginning. So how could you do things differently? So I always tell people that, first of all, fat is a feeling. You can't really feel fat. Okay, usually it's another underlying, and we definitely know this with our kids, it's an underlying feeling that they're feeling uncomfortable with. You know, some emotion is uncomfortable with. So you can reframe it as, I can imagine you're having some uncomfortable thoughts, you're having some challenging thoughts, you're feeling unsettled, whatever the word may be, and then you redirect it depending on the age of your child. You know, let's go play a card game. Let's go watch a show. In my house, it was, let's look at videos, or go online and look at puppy pictures. P.S. We wound up getting a puppy from all of that, but just redirecting it. But very, very important to not, you know, reinforce that idea that fat is bad. Here's another one. Number 4, fat phobia in the medical community. I don't think I said before, but every single one of these 10 topics, we could do at least a webinar about, a full webinar about it. But this one, we could probably do a webinar series. People may say, what do you mean fat phobia in the medical fields, in the medical community? How can that be? Have you all ever, if anyone resides in a larger body and they go to the doctor, or they have a loved one that resides in a larger body, or a friend, family member, whatever, typically they go to the doctor. And this is what happens. Have you tried losing weight? This is from Dr. Catherine Hill, who's a board certified pediatrician. I have mad respect for her. Every physician I know is extremely well-intentioned and truly wants the best for their patients. Yet, due to lack of training and pervasive fat phobia in the medical field, many physicians might unintentionally be reinforcing weight stigma in their patient care. For instance, it's common for a patient in a larger body to present with a concern unrelated to their body shape, like a sore throat, and the medical recommendation might be to lose weight. We hear these stories time and time again, and it's a shame. Different ways that weight bias can show up at the doctor's office. I know that before I did this work, I never thought about these things. And I think that it's really important when we're talking about how fat phobia can affect our loved one's recovery, that I start bringing these things, you know, to the forefront of your mind so you can start realizing it. Medical equipment that does not accommodate those in larger bodies. I hear from those, you know, people who live in fat bodies, that when they walk in a medical office, they can tell right away by just walking in the waiting room if this office is going to be safe for them. What do the chairs look like in the waiting room? Can they move their body around the office without bumping into things? Medical equipment, the blood pressure cuff. Do the scales accommodate? You know, can they get on the scale? Is the number big enough? This story is hard for me to tell because it's a true lived experience story of when I was a dietetic intern at Syracuse University Hospital. I was working with an outpatient dietitian, and I vividly remember her saying to me that our next patient, we were going to have to walk them to the shipping scale at the other side of the hospital, because our scale that maxed out at a certain number, I don't like to give numbers because people find that triggering, but our medical scale in the dietitian's office at a hospital could not accommodate our patient's body. So what we had to do was, I had to walk this patient across the hospital. They told me to the shipping scale. Now, when I say the shipping scale, and I had to walk my patient across the hospital, and that was a really long walk. He lived in a very large body. That walk was really hard. We had to take a lot of breaks, which in my mind, I was having my own thoughts that I wish I'll say something afterwards, but I had to bring him actually to the trash area. It wasn't just the shipping area where this big scale that went up to 1,000 pounds was actually next to the trash dumpsters. So I'm bringing my poor patient, I'm telling him, based, I don't know if it was a him or her, telling them that their body is trash. They have to be weighed with the trash. Okay. I wish that I could go back to younger Laura as the dietetic intern and change those thoughts to compassion and empathy and be able to stand up for that person. Again, judgment and shame for those in larger bodies. You hear over and over that, that people in large bodies go to the doctors for all different reasons. And they get the first thing the doctor talks about. They can come to the doctor with a cough, a sore throat, anything that doesn't have anything to do with their body weight, but the doctor talks about their weight, or the medical practitioner, doesn't have to be a doctor, giving simple advice: eat less and move more. If it was that easy, it's just, yeah, anyway, I take deep breaths when I talk about this because I get all riled up. The delay of medical tests, surgeries, diagnosis until patients lose weight. We know that intentional weight loss doesn't work in the long term, yet doctors or medical professionals will have someone in a larger body come to their office and they won't do certain tests, or they can't fit an MRI machine or what have you until they lose weight. Another example would be if I live in a smaller body. If I went to the doctor and I had a chronic cough, which actually is how you hear my voice now, years ago, I had that situation and couldn't get rid of the cough. I couldn't get rid of all these things. They did a battery of tests on me. Someone in a larger body could have had the same experience, and they go to the doctor and the doctor is telling them, that they need to lose weight. What I encourage people in larger bodies to say to their medical practitioner is, pretend that I live in a small body. What test would you do right now? Recovering in a larger body. Okay. Any of us have loved ones who are going through eating disorder treatment, but they're in a larger body. Treatment's not fair. It's not equal. And this is something I want to spend a little bit of time in because it's really, really important. Again, the stock photo here, done on purpose. You've got your happy, thin, white practitioner sitting there smiling, almost consoling, the patient in the larger body. Stock photos. Atypical anorexia. There's actually nothing atypical about it. Atypical anorexia was added to the latest DSM-5 as a diagnosis. The only difference about atypical anorexia with good old standard anorexia is that their BMI is in a quote unquote normal state. First of all, I don't even like to talk about BMI. Excuse me, I don't even like to talk about BMI, but that is an atypical anorexia. As I said, there's nothing atypical about it. How crazy is this statistic? Only 6% of people who have anorexia actually have a low body weight by BMI. So essentially 94% of people who have anorexia fall into this atypical anorexia. I think it should be the other way around, right? Because atypical anorexia is 94% of people who have anorexia. Atypical anorexia also has most of the same signs and symptoms, just the sufferer is in a larger body. Certain insurance companies outright deny coverage for treatment, and it's not uncommon to kick patients out of treatment after just 2 to 3 weeks. Again, all done on their BMI, right? Or their body weight. That doesn't mean how sick they are, how entrenched in their illness they are. A patient's perspective. I was actually messaging with Sharon this morning. Sharon Maxwell, I put up her Instagram. Is it an Instagram handle? I don't even know, but that's her account. Hey, Sharon Maxwell, I highly recommend to follow her. There was an article in the New York Times Magazine just this October called "You Don't Look Anorexic." That's a picture of Sharon at the beginning. Another person that I'll highlight from this story, her name is Shira Rosenbluth. I'm saying her name wrong. On Instagram, she goes by the Shira Rose. Both of them are fantastic fat activists to follow. I'm going to tell a little bit about Sharon's story that she talks about in the article, as well as I've heard her recently. There is a podcast that I follow called What the Actual Fork. And she was just in the latest episode. I was actually listening to it yesterday. And Sharon talks about recovering in a larger body. Her eating disorder was undiagnosed for 19 years. After over a decade, she was having mysterious health symptoms and was never given a diagnosis of an eating disorder. Listen to her symptoms. She had long absences of not having her period for over 10 years. She was often cold and suffered from dizzy spells. She fainted multiple times. Her hair loss was so severe that there was bald spots in her head. At one point, she actually brought baggies of her hair and showed the bald spots to one of her doctors. And they just kept, giving her other diagnosis. Till one day she finally saw a practitioner that looked at her as a whole person, didn't look at the number on the scale or her BMI. And they said to her, Sharon, you have an eating disorder. And she said, I don't have an eating disorder. What are you talking about? I have a self-control issue, and kind of laughed it off. Lo and behold, she finally went into treatment. And Shira Rose, the other person that I'm talking about that I mentioned, when they finally got their diagnosis, they went into treatment. And when they went into treatment, even though, and Shira talks about how she chose treatment centers that were quote unquote Hays aligned, but they weren't safe places for their recovery. They both told stories that they were given smaller portions of food. Shira wasn't even given snacks. At one story, Shira talked about how when you're in, whether you're in PHP, if it's an in-person one or residential, you'll often go on field trips as exposure field trips. And Shira talked about how they all went out for ice cream, and all of the peers in her group, they all got normal ice cream. But when Shira went up to get her ice cream, she was handed a kitty size. Same diagnosis, but she was being told right there, you need to eat smaller food, given smaller meal plans in treatment centers that were dangerously low calorie for someone in recovery from anorexia. Often bullied by their peers in larger bodies. Telling a story that when they were in a process group, a support group while they were in treatment, and one of their peers was talking and they were processing, and there was nothing wrong with what their peer was saying because it was their experience. And the peer was saying, if I ever get fat, I never want to be fat. Being fat is just disgusting and horrible, and I prefer to be dead than be fat. And here Sharon is sitting next to this person. Again, nothing wrong with what the person was saying, but that's not a safe feeling for someone in a larger body, someone in a fat body. And their peers are saying that they prefer to be dead than be in a fat body, all while this person's trying to recover from anorexia. Furniture is not always size inclusive in treatment facilities, okay? As well as if they're in residential, the towels aren't big enough, okay? The furniture is not comfortable. We prescribe to fat people the same things that we diagnose and treat in thin people. I was just listening, when I was listening to the webinars that I was just referring to, Sharon said young fat kids are being diagnosed, not diagnosed, young fat kids are being essentially being prescribed eating disorders when they're young. Lose weight, exercise more, restrict your food. So we're prescribing fat people the same things that we diagnose and treat in thin people. This is by Deb Burgard, who's a psychologist who specializes in eating disorder treatment. Let's move on, because again, I could talk about that one forever. Recovering in a society that puts thinness on a pedestal. I feel like we can all agree that in our society, being in a smaller body, being a thin person is usually the better thing. Thinness above all else. This is a quote that Harriet Brown, who is a journalist, a science journalist, she actually wrote the book Brave Girl Eating, if you all have ever heard of it. Fantastic book. So she interviewed a hospice chef in Wisconsin. And the hospice chef said to Harriet that many of the dying women who were still able to eat refused bread, salad dressing, butter, chocolate, desserts, and other fattening foods. In their last weeks, months, days of living on this earth, they're still wanting a healthy diet and they're still restricting. My mom, I was just in Florida last week. We're moving my mom into a senior independent living facility. And I was taken aback when we were doing the tour of the restaurants. They've got a couple restaurants on site. And one thing that stood out to me was on all the menus, the written menus, they have a visual menu, as well as, the specials, the placards on the tables. Every single food item had the calorie count next to it. Every single thing, whether it was the salad dressing to the ice cream to the pizza, every single thing. They didn't talk about sodium. They didn't talk about anything else because, yeah, maybe someone needs to watch something in their diet. Nope, just the calories. The message to be thin comes from everywhere. So while our loved ones are trying to recover and be safe, they're recovering in a society that the message to be thin comes from everywhere. Media and advertising. I'll get into this further in the talk, but gosh, even just think of Ozempic right now. Okay, weight loss injection. It's everywhere. You can't open a magazine or watch TV without talking about it. Our government, okay, a lot of the things when I was in school for nutrition, all the things I was learning about, they were government funded, the food guide pyramid, all the things. I adore Michelle Obama, our first lady, but think about what a lot of the first lady's initiatives were, okay? Making school lunches be healthier, working on, the obesity epidemic in young children, cultural societal ideals. Think about our Disney princesses. Think about Barbie. When we talk about what does the perfect male, female, human look like, doesn't matter their gender, what do they look like? Think about our ideals. The medical community, again, I'm bringing that up again. Think about when you go to a doctor's office. It could even be a dentist's office, a podiatrist's office, your acupuncturist, everywhere. The messages are all over about being healthy and being thin. I love this meme. Doctor, I've been impaled. Well, you'll feel better if you lose weight. We laugh about it, and it's true. Look at this book. This is the world our loved ones are recovering in. How to trick a fat kid into weight loss. It's just, I saw this, I was horrified. I had to share it. Fat phobia in the media. Really felt that it was important. I like to keep things very timely when I'm doing my presentations. And fat phobia in the media, think about the movie The Whale, Brendan Fraser. I think he just won the Oscar for it. I guess it was last week. I have a couple quotes from it because I, again, want to keep it timely. Some have called Fraser's transformation, and anyone that reads about it, you'll see people just in awe about it. His transformation into Charlie, he won an Oscar for it with the use of a fat suit, dehumanizing, pointing out that fat people can't take off their weight at the end of the day the way that actors can, and that fat actors were overlooked when casting the role. And this happens over and over again. I think that there was actually 3 people that were up for Oscars that all wore fat suits as part of their character, instead of actually having fat people in those roles. Aubrey Gordon. I'm a huge fan of Aubrey Gordon. She's a fat activist. She has a fantastic podcast called The Maintenance. What am I saying? The Maintenance Phase. She also has written 2 books, what we talk about and what we don't talk about when we talk about fat, and you just need to lose weight. Have it right here, actually. She says, if the only way you can humanize a very fat person is to watch them humiliated, terrified, ashamed, and killed off in a stereotypically stigmatizing way, it's time for us to do some serious reflecting. You just keep hearing the people say how it was such a beautiful performance because they felt they really could feel what it feels like to be a fat person. It was so compassionate when people who live in larger bodies actually felt so triggered and so upset about the movie. And that just shows how warped it can be. Think about fat characters in the media. I mean, I just think about my childhood and I'm aging myself here, but Fat Albert. Why did we even call him Fat Albert? I mean, hey, he was awesome. Loved Fat Albert. Didn't really matter that he was fat, right? Fat Monica in Friends. Why did, and that was mocked so much. I mean, you can see this picture here of her holding the bagel and she was Fat Monica. Fat Amy in Pitch Perfect. Yeah, hey, no, don't put me down for cardio. Our fat characters in the media are typically funny. Think about John Candy. Self-deprecating. They're rarely the main character, except in the case of something like The Whale. They're in the main character for a reason. They're typically not in a romantic relationship. Again, unless that's the reason of the movie or what have you. They're always that good, reliable friend. And there's always lots of jokes about weight and food. Social media, again, we could do multiple webinars about this, so I'm just going to touch upon it. I alluded before at the beginning of the talk about before and afters, okay, how harmful they can be. But over social media, it's hard to get away from them. Our Thinspo and our Fitspo, people, how much food do I eat in a day? What's my exercise thing? You see people posting pictures of themselves, in thin, fit bodies, which are usually filtered completely and in the right, lighting. And people are post underneath it. Tell me what you do. Tell me what you do. You could take 15 different people and you can put them all on the same exact diet, the same exact exercise routine, and you're still going to have 15 different bodies at the end of the day. Social media, perfectly curated photos. Okay, look at the images that are here. And again, this is what our loved ones, back to our loved ones in recovery, this is what they're looking at when they're scrolling nonstop. Healthism. It's a close cousin to fat phobia. Healthism refers to the set of attitudes and beliefs that health is the most important pursuit in life, and it is the personal responsibility of the individual and solely within that person's control. Those who subscribe to these beliefs view the pursuit of health, which is often conflated with thinness, as a moral good. I'm going to, again, could do a whole thing on healthism, but it's really time to, again, think about the environment our kiddos are recovering in. Okay, think about what we did. Okay, this was a quote that I saw yesterday, so I popped it as a slide in my Instagram feed by a fitness professional. Your choice, master your body or your body masters you. What does that mean? Say that to somebody who lives in a body who has a chronic illness and you're telling them to master your body or your body takes over. That, it's an extremely harmful way of thinking. So checking our healthism at the door. Healthism and eating disorder recovery pitfalls. We don't eat junk food in our house. That's actually a blog post that I wrote for Feast that, people still say to me, gosh, I read that. And that really resonated with me. Thinking about, if your loved ones, if, their whole life that you never had the candy and the food and different things in your home. And then they go through recovery and you say, I won't have junk food in my house. We have a healthy home. I challenge people to change that. Okay, there's no junk food and good food. Food is food. There's a place for all food in life. I can't gain weight as it will be bad for my health. I really talk about breaking apart, health from weight. Okay. Fruits and vegetables. Love fruits and vegetables. I'm a health professional. However, in recovery, we really want to talk about getting that weight on as fast as possible. And you only have a certain amount of real estate in your body to, fill our loved ones' bellies up. Fruits and vegetables often take a side road unless they're covered in heavy whipping cream or butters or cheese. I hear this a lot. My loved one looks so puffy. It just can't be healthy. We may feel that discomfort when our loved one starts to put on that weight. If we're feeling uncomfortable about it, we know our kids are feeling uncomfortable about it. So we need to learn to be okay with that, to realize that puffiness is actually their recovery. And that's awesome. I hear all the time, when can they stop eating like this? I always say back to caregivers, what do you mean by that? Like this? Eating is eating. Eating disorder providers that carry weight bias. Unfortunately, fat phobia occurs in the field. And I think it's really important, even as a practitioner right here that sits in front of you, and I live in that stereotypical body. There are providers that carry weight bias, and it can affect your child's recovery. Again, another stock photo showing this point exactly. Some red flags, because again, I could do webinar upon webinar about this. There's plenty of providers that set their target weights way too low, that leave their sufferer never attaining full recovery. They set target weights based on BMI. We need to learn to set target weights based on people's own growth curves. Okay, where were they? Where did they fall off? And, I see people all the time in our forums that are saying my child's weight restored. And when we really look at that, we realize that they're not weight restored. They're not even close to weight restored. And yet their doctors are telling them that that's all they need to, that's all the weight that they need to gain. Providers that say, I promise I will not let you get fat, or caregivers that may say this to their child. Huge red flags. Okay. Having a provider that does not have an all foods fit or HAES philosophy. The eating disorder community as a whole. I'm talking about clinicians, treatment centers, and advocates. Thin white women and girls fill the visuals and stories on eating disorder websites, articles, blog posts, awareness pieces, as well as filling the space at eating disorder conferences and events. We're doing a better job, but it's still there. Again, using these photos, one is actually from a very renowned treatment facility, and the other one's a stock photo. Eating disorder research often historically neglects marginalized individuals and their diverse paths to recovery. So we're looking at our research, but our research is very skewed. Popular media depictions of people with eating disorders also overwhelmingly focus on thin white females. Okay, that's what our kids are seeing. That you could have someone in a larger body, but they're not seeing that in the media, in the websites they're looking at. I have to end with this one. Okay. Just recently, the American Academy of Pediatrics, which is dedicated to the health of all children, put out on January 9th, the American Academy of Pediatrics issues its first comprehensive guideline on evaluating and treating children and adolescents with obesity. We're trusting our pediatricians, and they put out these guidelines that, as Aubrey Gordon said, the new AAP guidelines are focused solely on weight, not health. I'm not going to go into the details about this because Feast did an awesome job on January 31st right away. And you can find this in the webinar archives to watch this beautiful webinar about all the guidelines. But essentially by the age of 2, the guidelines are talking about putting our toddlers on weight management programs. By the age of 8, talking about weight loss drugs. And by the age of 12, talking about bariatric surgery. What message is that sending to our loved ones? So, things I would like you to come away with from this talk. Fat phobia and weight bias is riddled in the entire medical and eating disorder community. Being aware of that. Awareness of your own internal weight bias. Opening your mind and educating yourself. And remembering that this is a process. To bring it back down to my walk, this was the view at the top. Okay. The thing I didn't talk about was the way down was much harder than the way up. And I think that also has to do with recovery. It's a process that we have to be gentle with ourselves as well as our loved ones. Thank you guys so much. I'm going to stop.
Thank you so much, Laura. Before we get into questions and answers, I just wanted to say, you mentioned that 6% of people with anorexia are not underweight. I think that statistic is 6% of people with eating disorders. I don't think it's anorexia.
I actually just heard it was anorexia, but we can look that statistic up and double.
Okay, no, I'm pretty sure that it's eating disorders, but everyone look that up.
Yes.
Okay, so let's just quickly go through a few questions. So the first question is, someone who's stuck on knowing what support to give when those in a larger body don't want to accept being in a larger body for all the reasons that you talked about. Where do you start? Where do you start helping someone to accept a larger body?
You know, I think it's a lot of compassion. I think that you have to validate their experience. That's usually my answer to a lot of things, but really validating where they are in that experience. There's a lot of education that can go on there. I also really, really recommend, finding other people that are recovering in larger bodies, really learn what does that mean. Getting involved in more weight neutral places and making sure that their providers are weight neutral too, that they're going to be safe during recovery.
Okay, next question. What are the best signs that a patient has met their healthy weight? If it takes longer for the brain chemicals to switch and behaviors to change, then how can we tell? Is the return of someone's period a key indicator? That's a good question. And it's something that I know parents encounter a lot. How do you know whether the target weight is the actual target weight?
So the best way to know, I'm going to touch upon the period because I think that's really, really important. I definitely have families that once the period comes back, they think the kid's recovered. The two things I'll say about that is their period came back, or it could be lab values as well, the day before they didn't have it, right? So they're just there at that point. That doesn't put you in recovery. That's a sign that they're going towards a healthier state. I say healthier like this. So the period return is just that you're on the right path, but there's a lot more recovery that has to happen after there. Knowing when they're healthier, I look a lot more at behaviors. Okay, so do they have eating disorder behaviors? Someone could be back to that target weight that their practitioner may give them, but they're still so entrenched with that rigid thinking and the behaviors, and they won't eat a morsel off their meal plan and everything has to stay as it is. They're not, most likely not at that healthy weight yet. So behavior based.
Okay. The question, you actually covered a lot of it, but I'm just going to put it out here anyway. Can you speak to resources for parents who are working on addressing their own fat phobia or disordered eating while supporting their child? I know you mentioned a lot of resources, but are there any specifically for parents working, on their own weight bias?
I can't think of one I don't want to plug anything I do, but right off the bat, just know that you're not alone. One of the first books that I read really to educate myself that did my shift, and I was a tough nut to crack based on what I did professionally, was the book called Anti-Diet by Christy Harrison. I wish I had it right here. It's in my office downstairs. I highly, highly, highly recommend reading that book. Because I needed to understand from science. I needed to be educated. And that book really, really explained a lot of things for me. It didn't jump necessarily into how I felt about my body, but it really educated myself on what healthy really means. And that really just shifted so much for me.
Thank you. Unfortunately, we are pretty much out of time. I want to say thank you so much, Laura. As you're going through your slides, I was thinking to myself, really what you said, that each one of your points could be an entire webinar. And you really just touched on the tip of the iceberg, unfortunately, with the time that we had, but it was really, so vital and so important. And I really, really appreciate, you're talking about the topic. So I just wanted to end by saying that Feast relies on the generosity of our community to operate all our services and all of our programs. So if you liked this webinar, if you'd like to see more programming like this for free, then please take the opportunity to donate on the Feast website. And finally, I just wanted to end with next month's webinar. It is Dr. Ross Crosby and Millie Plotkin talking about tips for researching and understanding data on eating disorders on April 19th at 1 p.m. Eastern time in the US, 5 p.m. England time. And I really hope that you join us then. So again, Laura, thank you. Thank you so much, everyone, for joining us. And we will hopefully see you next month.